Speculum and Bimanual vaginal examination. Introduction. In this video, we will learn on how to examine female genital tract, mainly in patients who came for vulva or vaginal symptoms, abnormal uterine bleeding, prolapse or incontinence, pap smear test, and sexually transmitted disease screening. Equipments. We'll need cotton swab, hand rub, gloves, lubricant, and speculum, either Cusco speculum or Sim speculum. Introduction and consent. Start your examination by introducing yourself and your lecturer to the patient. Ask for patient's permission and verbal consent. Explain briefly to the patient about the procedure.
Assalamualaikum. My name is Dr. Azhar. Before I proceed, may I confirm your name, please?
I'm Khadija.
I'm going to perform an internal examination of your pelvis. This will involve looking and feeling around your genitalia. It could be a little uncomfortable, but it should not be painful. Should you feel any pain, just let me know and I will stop. Throughout the examination, there will be a chaperone present.
Privacy. Pull the curtain to preserve patient's privacy. Hygiene. Use the alcohol sanitizers and wear gloves before touching the patient. Exposure and position. Ask the patient to remove the lower half of their clothing, including the underwear. Put the patient in lithotomy position on the examination bed, and to preserve patient's modesty, cover the upper half of the patient with a blanket. Speculum examination, pre-examination preparations. Test the functionality of the speculum prior to examination. Any defective speculum might precipitate injury to the patient. Inspection. Use the soaked cotton swab to clean the external part of the genitalia. Examine the external genital region for any abnormal masses, swelling, scars, discharge, bleeding, rashes, or vesicles. Ask the patient to cough to assess for vaginal prolapse. Using Cusco speculum. Lubricate the tip of the speculum. Separate the two labia majora using the thumb and index finger, while the other hand slowly inserts the speculum into the vagina. As you insert the speculum, make sure that the valves are in contact with the anterior and posterior wall of the vagina. Open and lock the valve of the speculum gently, and with the aid of a bright light source, inspect the cervix for any masses, ulcers, or discharge. Pap smear can be done by inserting the endocervical brush into the external os. After finishing the examination, unlock the valve and remove the speculum gently. Using Sim speculum. Lubricate the tip of speculum. Separate the two labia majora using the thumb and index finger, while the other hand slowly inserts the speculum while retracting the posterior vaginal wall. Inspect the anterior vaginal wall for any masses, ulcers, or any discharge. Ask the patient to strain to detect any prolapse. Remove the speculum and reposition it against the anterior vaginal wall to inspect the posterior vaginal wall. Remove the speculum gently and clean the region around the genitalia using tissues. After the procedure, thank the patient for their kind cooperation. Bimanual examination. This procedure will involve using the index and middle finger. Lubricate the tip of the fingers. Separate the two labia majora using the thumb and index finger of the other hand. Insert the lubricated fingers gently into the vagina. Assess the vagina and cervix and observe for cervical excitation. Palpate the uterus per-abdominally while pushing the cervix upwards bimanually. Palpate the adnexal area for any abnormal mass. After completing the examination, withdraw and inspect the fingers for any blood or discharge. Clean the region around the genitalia using tissues. Thank the patient for her kind cooperation.